I'm Renae Phillips. I am the Chief Nurse Executive at Dayton Children's Hospital. And when we began exploring the concepts around evidence-based practice and moving on our magnet journey, we determined that we really felt that the staff nurse, those at the core of everyday work, everyday care of our children, needed to understand why they did what they did and to do the very best practice. And so evidence-based practice really is foundational to everything we're doing in promoting the professional practice of nursing. Being in Ohio, we were fortunate when Dr. Malnick brought her program to Ohio State and the Center for Transdisciplinary Evidence-Based Practice opened. When that program opened, we thought, wonderful, this is a place we could engage with the CTEP and promote, really, evidence-based practice here. We were fortunate in that we worked with Lisa Long, one of the faculty from the CTEP program, in an early research study. We wanted to determine if, in fact, our nurses knew enough about evidence-based practice as a foundation for our magnet journey and for what we were doing with best practice. After we did our research and our little pilot, we determined that we really needed staff to be educated. The immersion program was a great opportunity, and we were able to identify staff to go. In our Shared Governance Council, we have a whole council focused on evidence-based practice. That council leadership, half staff, half administration, that council leadership came to us and proposed, if we're really going to do evidence-based practice, we really need to get the resources here and get our staff equipped. After we got that request from the council, we said yes, and the nursing leadership team said, we'll do this. Let's move it forward. We need something that is ground-based, coming up from the staff themselves, and really support it from leadership down. From there, we moved forward with CTEP and got our staff involved in an immersion program and in a pilot as a community hospital. We identified nurse practitioners and an educator to participate in the immersion program. And when they went and came back, they said to us, how about we ask our unit councils to get involved? We actually used the process of the unit councils to infiltrate the rest of the organization about evidence-based practice. We actually piloted a project with our immersion team to test whether or not our nurses could get it as part of the council. Then the group came to us and said, really, everyone in leadership needs to know. And so we did a really big session one day and had about 80 people come and have a kind of a 4-hour mini course so that staff nurses and nurse leaders could understand what the concepts were, what our intent was, and how we were going to use evidence-based practice to support the nursing process at Dayton Children's. In our neonatal intensive care unit, there was a big question asked by our staff related to green products, being able to say what is the best kind of product we should use for our patients. So the team worked with our nurse practitioner, Lisa Jason, and our nurse educator, Karen Beekman, to be able to put into place some trialing and testing around using green products or healthy, safe products for our infants. That team is continuing to work through it and going to use all the evidence-based practice information to make a determination about whether or not we should change products. For years, there's a little phrase that's, that's the way we've always done it here. And as a leader, that's not really a good answer anymore. We really have to be able to have our staff ask the right questions, to query, to determine whether or not what they're doing is not only supported by the literature, but produces the outcomes that we want. So on a personal basis, as a leader, it's really important to me that our staff understand, are able to make the right questions, have an attitude of questioning, really do critical analysis of what they're doing and why they're doing it, and all of those things really support, from my perspective, what a nurse leader is supposed to do. Evidence-based practice is foundational to everything that we do in nursing.